Black domestic workers in New York City proudly hail from St. Vincent, St. Lucia,
Jamaica, Trinidad,
Dominica, Antigua,
Tobago,
Belize,
Grenada,
Barbados,
Turks and Caicos, St. Kitts,
just to name a few.
There are over 200,000 domestic workers in New York City, and a lot of them are home.
We are just a collaboration of Black women, proud and strong, to make this country what it is.
We surveyed hundreds of Black immigrant domestic workers in New York City, and the results speak to the issues domestic workers face and the need for change.
Black immigrant domestic workers in New York City are at the epicenter of 3 raging storms: the pandemic, the resultant economic crisis, and structural racism.
We are the most vulnerable in the whole of America.
"62% of Black immigrant domestic workers in New York City have either been fired, have fewer work hours, or less pay, regardless of their immigration status."
I think I was the first person to be fired because of the coronavirus, and from that time to now it's been 3 months. I haven't had a paycheck.
For a lot of us, it is paycheck to paycheck. By the time you do all your necessary things, there's usually no money left over.
We have no safety net, none at all.
It's heartbreaking to know 80% of undocumented workers will not seek government assistance because they're afraid.
We are afraid to go and ask questions. We are afraid to go and ask for help.
Domestic workers are going to work during this pandemic, but the majority of them are not provided with personal protection.
75% reported not having personal protective equipment from their employers, forcing them to work in unsafe conditions.
They didn't say come in for PPE. They didn't say we're going to mail it to your home.
I am worried about going back to work. I'm worried about traveling. I'm very scared to go back on the buses and the train.
83% of undocumented workers have no health insurance. We think of the pandemic, a situation where domestic workers are going out to work and putting themselves at risk, but they have no health insurance.
If I would go to work with this pandemic and I get sick, there is no shelter for me. There is no fallback for me. I have to fight it from my pocket.
Because of this whole thing, you see how left out domestic workers are, immigrants are. We are getting no help, nothing.
Black women, we have always had to sacrifice ourselves and our families to take care of our employers.
It's time to value the Black women who care for this city. It's time to include domestic workers in the New York City human rights law and the paid personal time law.